We're at the IAS meeting in Vancouver. We're here with Diane Doyle, who is the CEO of Providence Healthcare in Vancouver, and also which a part of is Center for Excellence, which is Julio's organization. And actually, Irene gave me this tip at the opening session that you were there, and about the drama that unfolded many years ago at the beginning of AIDS, way back at the beginning. And you were kind of a hero. You were a nurse at the time. And the people at different hospitals didn't know what to make of this KS and whatnot that was showing up on their doorstep. And they knew this was another one of those cases. And they would put them in a cab and give them a cab fare and just say, go on to see Diane Doyle over at Providence. And there you were, taking them like an angel. And that is something that I think we don't think much about anymore. We don't think about those days, the drama, the grim prospects of what life was, if there was a life ahead for people. And those days are not known at all by the younger generation. Right. But my date of infection was July of 1980. So I was back at the beginning as well, so 30-some years ago. What I'm looking at now is a life, which I never thought I would have, and not only that, but a healthy life. And I think working at it is what makes it happen. The work that you did, though, is remarkable, and you might want to tell a little bit more about some of those early events that happened in the early days.
I'd be happy to, but I certainly don't want to take the credit for being a hero of any kind. There were many heroes in responding to the AIDS epidemic. But I was a staff nurse working at St. Paul's Hospital when the epidemic hit Vancouver. And as you say, no one knew really
it was scary.
What this disease was. And we had a very young Dr. Julio Montana actually working in the critical care areas then as a lung specialist. And many of the patients that were showing up at the door of St. Paul's Hospital had these very strange lung infections. And so that's how Dr. Montana got involved. But in those early days, it was just devastating. We had many of the nursing staff at St. Paul's came from the gay community, and just so terrible to have them impacted, seeing them, our colleagues, die, to have them working as nurses and see their friends and colleagues coming into the organization, and a real sense of hopelessness, really, at that point in time, because we didn't know the cause, we didn't know the transmission, and we certainly didn't know the treatment.
And for you and your colleagues and everyone in Vancouver, it must be a wonderful moment, not only back in '96 when we had the first conference here, and we saw the beginning of treatment that worked, and now we see her here at and this day and age where we are having prevention works, hepatitis C treatment works, and HIV treatment is fairly innocuous and functional, and for most people, not everyone. But I appreciate you're taking the opportunity, because you're not actually coming to the conference. You came special to do this interview, so we really appreciate that. But can you tell us some of the challenges you still face here? I mean, I know that Julio has been a champion of needle exchange, because that was a critical part of improving the outcome of some of the folks in that community.
Yeah. Well, first of all, what a privilege it is now, all these years later, for me to have seen the journey that St. Paul's Hospital and our Center for Excellence have taken to bring improvements in the diagnosis and treatment of HIV/AIDS. So to go from that devastation in the early ages, early parts of the epidemic, to now being on the world stage, really partnering with brilliant minds from around the world and ensuring that the treatment for HIV/AIDS is available and making an impact on the global scene. But there is still a lot of work to be done. There's still stigmas that are attached to individuals who have HIV/AIDS. There's still very limited access to the kinds of programs that are the harm reduction programs that we need, such as our safe injection sites. I mean, to have Vancouver as the only safe injection site that's operating in North America, it makes no sense.
That's insane.
It is insane, and the evidence is so strong that it is the right thing to do, to take a harm reduction approach, to take a population health approach, to take a treatment as prevention approach, and to spread that evidence to others and encourage and support others to provide that access. Not only in Vancouver and BC, but across our country, across North America, across the world.
Great models, and that's the other thing. I know that Julio Montana gave me the privilege of meeting one of his health economists who helped us understand how they measure and how they evaluate the risks and so forth, and the need for, and the way to deploy treatment, and also an effective, cost-effective way, and that it is cost-effective.
For sure.
You know, it apart from the fact that it's obviously humane and a humankind thing to do. So, but yeah, so the challenges that you face are probably still there, even though you're in one of the best areas of, say, Canada and North America.
Right. But one of the challenges is also a great opportunity, and it is to take this same approach that has been applied through the Centre for Excellence to HIV and now spread it to other disease entities. So that whole concept of treatment as prevention, I predict, is going to be just very impactful in other drugs. Hepatitis.
I was going to say hepatitis C is the classic example that needs to be followed, because that is a curable thing right now. Obviously, we're looking to cure AIDS, and that's being researched. But there is a cure for hepatitis C. And also there's a responsibility from within the community to understand that they don't want to be reinfected. And I imagine going through any course of treatment is worthy of understanding, apart from the fact that it costs a lot of money, to not have that happen again. So.
Yeah, so the challenge with taking the concept and applying it to hepatitis is partly or largely even economic, because the evidence exists for what is the right treatment. The drugs at this point in time are fairly expensive, and so again, to take this concept and apply it to a whole population that is very, you know, a very prevalent disease right now, hepatitis. So, but treatment as prevention can be applied if we put our minds to it, have the right policies, and make sure the economic arguments that have been developed are heard and understood by the funders.
I might ask you also, and I don't know whether this is something you're working on specifically, or someone in your organization is, but education seems to be a very large part of patient education as well as provider education. Sometimes you do it at the same time because there's really no difference in the message. But it is important to understand that the messages change, and so you have to update people according to what it is. Obviously, now everyone should be treated. That's a message that was not, but a few years ago, different. And now with the WHO guidelines going in that direction, it seems as though this is something that needs to be become part of the fabric of our understanding and education programs.
Right. It's just such another fabulous learning that all of us can have from the Centre for Excellence's approach to HIV, and that is how important it is to do the education, not only at the local level with patients or groups of patients or individual patients, but also with the care providers. So the Centre has been committed to bringing together on a very regular basis large groups of individuals to ensure that the ongoing updates about the best treatment and the newest evidence is known by all. And then it's also how do you communicate that, yes, at the population health and global level, so that everyone understands.
And the unique and or otherwise hidden, or you know, hidden populations, I guess the way to put it, because the people who are most in need are probably the ones who are least likely to get the information and are least likely to access the information. So that's a big struggle.
Well, it is, but another learning that comes from the Centre, because one of the ways that the Centre has tried to mitigate that is to involve patient peer navigators, if you would. So individuals who themselves have been infected and are on treatment, and to use them to spread the information and the latest practices and provide the support. So, you know, the rest of us are still catching up to some degree around that applied to other disease entities. But the Centre is miles ahead and years ahead in terms of applying that very simple concept of how do we involve those who are most impacted
Most needful of
in
it,
everything, the education, the policy development, the advocacy. So it's a very strong model.
Well, Diane, I really appreciate you taking the time with me here today and making a special trip here, because it's really important to have this message put out there by leadership. And I call you and Julio and Irene and the rest of y'all are really leaders. And certainly AIDS has taken a leadership role in the whole concept of I mean, we've broken ground in every direction.
Absolutely.
But I think there are people like Julio who have really led the fight and have led the way and have guided everyone else. I mean, there certainly, like you said, there are other champions, and apart from yourself in the city. But when we look back on the things that have been most meaningful, it's been the leaders who have done the work, such as Yo Palanga, who died in the last tragic airline crash. And even I refer back to Jonathan Mann, who died way back in, actually, 2 years after this, I met him at this conference 2 years ago, or the conference in '96. It was introduced to him at the Elizabeth Taylor event at the Art Museum, and 2 years later he was gone.
Yeah,
It's just tragic that some of the best and the brightest have not made it through the.
But we do stand on the shoulders of those who have gone
and
before
I think
us.
maybe
so.
because, not because of, but we continue the fight
Absolutely.
with them in mind.
Absolutely.
And with the respect that we give. And that's the way we respect their lives.
No, they continue to be an inspiration. But I must say, Dr. Julio Montana has been such a strong and passionate advocate. So
He's
he
tireless.
does deserve to be singled out for his efforts.
After every conference, I see him in the hotel lobby. We usually stay at the same hotels.
Okay.
And I see him totally exhausted.
Oh, I know.
And,
I don't
but
know how he does it.
But up to that point, I saw him walk by a second ago. He is moving. He's moving and shaking hands, making sure he connects to the right people, and does everything he needs to do at these conferences, signing documents, making sure that everyone's on board with the mission, and with the newest of the branding, which is all important for goals.
Absolutely. But it's one thing that I like to make sure everybody understands is when the AIDS epidemic first was hitting St. Paul's, patients arriving at St. Paul's, and Julio and his colleagues were there. It really was the sisters and the philosophy and values of the Sisters of Providence who had founded St. Paul's that allowed them to embrace the patients, not knowing exactly what we were dealing with. And it was the sisters' values that really laid that foundation to allow the evidence and good work to come forward that has had such a tremendous impact in the end.
And that's genuine. It's real genuine.
Genuine.
Yeah.
Yes. I think it's no happenstance that the Center for Excellence is housed in an organization such as St. Paul's Hospital that is founded on such strong values of compassion and social justice, because that really hooking compassion and social justice up with the science is what ended up in the success that we've had.
Very good. I'm so proud of this conference. I'm proud of Julio and the work that you've done and continue to do.
Well, I'm privileged to play a small role in supporting the brilliant minds that are collectively making an impact. So.
Thank you so much.
Well, thank you. Appreciate it. Appreciate the opportunity.